Hello, my name is Dr. Dewan S. Raja. Today I will discuss about small cell lung cancer. Small cell lung cancer is an aggressive form of lung cancer characterized by rapid growth and early spread to distant parts of the body. It accounts for about 10 to 15% of all lung cancer cases and is very strongly associated with smoking. Key characteristic origin small cell lung cancer originates from the neuroendocrine cells in the lung, particularly in the bronchial epithelium. Growth and spread, it grows quickly and is more likely to metastasize early compared to non-small cell lung cancer. Appearance under a microscope, the cancer cells are small, they look blue and have a high nuclear to cytoplasmic nuclear to cytoplasm ratio. Okay, if you look at the histopathology, this is the small cell carcinoma, small to medium sized cell, like this is a cancer cell here. Minimum cytoplasm is very minimum. Most of the part is occupied by the nucleus. The nucleus of a cell is round to oval, blue to purple, finely dispersed chromatin, no distinct nucleoli. Nuclear molding is also shown here, and there may be nuclear smudging because the nuclear material, the bluish color material, will come out and will stain the surrounding structure or layer. So, stroma of the cancer is scant, it is fibrovascular, the stroma. If we look at the cell, if we go through the cytology of small cell lung carcinoma, we'll see a small amount of cytoplasm. Just this part is cytoplasm. This entire part is nucleus. Nucleus with fine uniform chromatin, no visible nucleoli here. And mitotic figure, it is a very much rapidly growing tumor. So mitotic figures are also very high. Small cell lung cancer, if we go there, okay. So we have gone through histopathology. If we go to the risk factor, smoking, the strongest risk factor of small cell lung cancer. Second-hand smoke exposure, another risk factor. Environmental occupational exposure, radon, particularly people like to stay in the mine or like to stay in the cellar or basement of the home. Asbestos exposure, other carcinogen exposure, exposure to industrial chemicals such as arsenic, chromium, nickel, and coal products can elevate risk. Genetics, family history of lung cancer, age, small cell lung cancer more common in older adults, typically those over 60 years of age. So these are all risk factors. Symptoms, small cell lung cancer symptoms often arise from tumor growth or metastasis and include respiratory symptoms, persistent cough, shortness of breath, chest pain, or wheezing. Systemic symptoms, unintended weight loss, fatigue, or fever. Paraneoplastic syndrome, hormonal immune related effects such as syndrome of inappropriate antidiuretic hormone. Cushing syndrome, because there is some secretion of ACTH that is related to tumor, or neurological symptoms. Other signs, hoarseness, because the cancer usually in the central part of the chest and then spread outside. And if you go to involve the recurrent laryngeal nerve, then we'll get hoarseness of voice, difficulty swallowing, swelling of the face that may be due to superior vena cava syndrome, swelling of the face or neck, Small cell lung cancer can lead to, we have just discussed, swelling of the face and the upper extremity, superior vena cava syndrome, Horner syndrome, because the sympathetic innervation to the head and neck will be blocked. We will get ptosis or drooping of the upper eyelid, miosis, pupil will be dilated, okay, and hydrosis. One side of the body where there is a sympathetic innervation that will have anhydrosis, no sweating, and in ophthalmos, eyeball seems to be sink back. Okay, these are the features of Horner syndrome. It may be associated with small cell lung cancer. Staging of small cell lung cancer is typically staged into limited stage and extensive stage, two type of category. Limited stage confined to one side of the chest and can be treated within a single radiation field. Extensive stage cancer has spread beyond the chest or to other parts of the body. Diagnosis: imaging, chest X-ray, CT scan, PET scan, PET scans, MRI, especially the brain, given the high likelihood of metastasis. Biopsy, bronchoscopy, needle aspiration, or surgery to confirm the diagnosis. Lab test, blood test, and tumor marker analysis. So these are the way of diagnosis. We'll give emphasis on CT scan and PET scan. Okay. Now, if you look at the chest X-ray, what is the cancer in this chest X-ray? This is the cancer. So it may involve multiple other structure like the sympathetic chain of ganglion that may lead to hoarseness of voice. If it goes up, involve the recurrent laryngeal nerve, then certainly we'll have hoarseness of voice. So we got the chest X-ray. Here is the tumor. Okay, apparently like that. Biomarker of small cell lung cancer. We have biomarker, immunohistochemistry. Small cell lung carcinoma usually shows the following result: chromogranin, it should be positive, synaptophysin positive, CD56 positive, TTF1 positive. We'll give more emphasis on these two, chromatogranin and TTF1 positive. Treatment depends on the stage and overall health of the patient. Chemotherapy, first line treatment, often combined with other therapies. So cisplatin, carboplatin with etoposide, these are chemotherapeutic drugs. Radiation therapy frequently used alongside chemotherapy for limited stage disease. Prophylactic cranial irradiation prevents brain metastasis in patients with limited disease or good response to initial treatment. It may not be always possible to prevent the brain metastasis. Immunotherapy, checkpoint inhibitor, that is atezolizumab or durvalumab, are sometimes combined with chemotherapy for extensive stage disease. Palliative care to manage symptoms and improve quality of life. Prognosis of small cell lung cancer: in case of cancer with limited stage, median survival rate 12 to 16 months with treatment. Extensive stage, median survival is about 7 to 12 months with treatment. 5-year survival rate generally low, 5 to 10%, due to the aggressive nature of the disease. The most common site of metastasis is brain. That's all about small cell lung carcinoma. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.